670 WOCA.
Ocala.
All right, 6 minutes after 11 o'clock, Dr. Riadh Fakhoury is in the studio ready to host his show. This is called the Head to Toe Care Show because it's everything from the top of your head to the tip of your toe. We talk about the head a lot, headaches and stuff, and that seems to be something that a lot of people want to know about because when you have one, you want to know how to get rid of it and see if there's something you can do. And Dr. Fakhoury is here to answer that and any other question you may have. The phone number here is the WOCA Climate Control Source Hotline. 352 is the area code, and then 622-9622. And Dr. Fakhoury is a chiropractic orthopedist and the owner of Fakhoury Medical and Chiropractic Center. And his phone number at his office is 351-3413. We'll tell you more later. Good morning, doctor.
Good morning, Larry.
How you doing?
I'm doing great. How about yourself?
Do you work out?
In the office.
You do a little bit.
Moving patients and.
Oh yeah. Well, your work is working out, right?
That's lifting and
Absolutely.
shifting.
So I have a maybe the easiest question I've ever had for you, but it's about muscle groups.
I'm worried because when you say it's the easiest one, it might be.
Well, it just seems like maybe something so obvious that I'm just not seeing it. But when somebody's working out and they have hurt what the gym instructor says, your muscle group is sore. You need to work other muscle groups while that one's recovering.
Okay.
Explain that. I mean, how do you do that? How do you stop using a muscle group? And what is a muscle group?
Well, muscle group, you could say, is a grouping of muscles that have similar or the same action. And like for example, let's look at the word bicep. Bi means two, so it's the muscle in the front of the arm.
Okay.
And there's two parts to that, or two, the short head and the long head.
Okay.
So a muscle group is you could isolate it to that. You could also say the quadricep, which is in the front of the thigh. Quad means four. So there's actually four muscles that come together either individually or as a group, but with similar or the same type of functions, and that are grouped together. But in this scenario, since it's workouts, what we're talking about is muscles that have similar actions. Like for example, to be able to push your arms away from your body ahead of you, or to push your arms over your head, uses certain muscle groups that will allow that function. So in a scenario that if you're doing a bench press and pushing the bar away from your chest,
right,
then you're going to be using the pectoralis muscle, you're going to be using the deltoid muscle, you're going to be using a little bit of a little bit of back muscle, but your main muscles are your front muscles that are doing that job. So if you do chest, for example, for the day, that's a muscle group. They just call it generally the chest, which is your pecs and your biceps and your deltoids. So that works the front of your body. Well, if you do that 2-3 days in a row, you fatigue that muscle, and the muscle doesn't have recovery time. So you want to allow the muscle to be able to recover, so that way it doesn't get fatigued and injured, and your exercise is going to be more efficient that way. So what they might do is they might do the chest group or the front that day, and then 2 days later do the leg muscles, maybe the front of the leg and the quadriceps or the hamstrings, and do the legs the second day, and then maybe the next day do your back muscles, and then the third day do maybe cardio or your stomach and glute musculatures, and then rotate back to the chest muscles again. And so the chest pushes and presses, the back muscles pull back and pull down, and the leg muscles, of course, either you're going to be bending the knee or straightening the knee to strengthen the leg musculatures.
Now, when we started, you were telling me that in your work, you're obviously working your muscles every day, so you don't really have a luxury of taking a day off from using those muscles, because and an extreme example would be the guys who built the railroads. I mean, every single day with those big, long things and heavy things. So
or the people who build the roofs, or the people that are putting asphalt on the ground. A lot of physical work on a daily basis. To be able to survive in that and be able to have longevity, you have to use good mechanics, and that's extremely important. It's your ergonomics and your mechanics. How are you using your body? Are you doing a stress on your body over and over every day that's going to take its toll and shorten your ability to be able to function? Or are you doing things correctly? So when when I'm working with a patient, a lot of times, just because of the experience, I can move that patient without putting a lot of stress on my body, but by working with them. Like, for example, people, when they're on their side, might just lift up a little bit for an instant and not realize it, but that's my time to set them in a better position for the adjustment. Or when I'm giving somebody what we call the hug of the day, which is an anteriority, or adjusting the mid-back, where we cross the arms in front of them and raise them up and bring our hand behind them, adjust the mid-back region, which is very helpful for rib problems and mid-back pain. The patients are heavy sometimes. However, by the curling of their head and the using of my legs by dropping down and bending my knees, I'm using my ergonomics and the patient's ergonomics to make the job much easier, so it's less physical stress on me and more comfortable for the patient also.
By the way, last week we were talking about NASA and how they have taught their astronauts how to have some chiropractic skills.
Yes.
Somebody sent me an email and it said, "Did you know about the nasal? I guess the nasal passage." Well,
Okay.
basically, what the article said was that in gravity, when we're on Earth, the function of the nasal is dependent on gravity.
Okay.
So your nose isn't, I'm going to mess this up, draining all right? Whatever's in your nose doesn't move in zero gravity as it does on Earth.
Interesting.
And the chiropractic techniques involve the face as well. And
Yes.
the article was amazing that, so you don't have this because you're not up in space, but do you ever have to actually massage somebody's nose and face and all that?
You know, I want to see that article. Now you've got my interest
I
up.
know.
So if
I'm sorry.
If you can get hold of it. But yes, we do work the facial bones. A lot of people who are having sinus types, headaches, trauma to the face where the facial bone shifts, TMJ problems where people see a dentist and they open their mouth really wide for an extended period of time and they have pain in the jaw, which can go to the ear.
I hate that.
And so in scenarios like that, yes, those facial bones move, and we have training in being able to help them go back into a better position. Sometimes one of the most painful things is trigeminal neuralgia. Extremely, tic douloureux is another name for it. Extremely painful. Feels like a knife is stabbing you. And we do facial work on the muscles and on the bones to help relieve the pinching of that nerve that's causing that extreme pain. And so yes, along with the neck, sometimes we're working people who have sinus problems. I was blessed to be able to train under an old timer from many years back when chiropractic was really in its infancy, and he learned techniques that were lost over time, where you can actually go into the mouth and do work on the soft palate, the hard palate, the hamulus bone, and also swiping the eustachian tube to be able to help people to drain better, so that way their circulation of fluids in their head is improved.
Wow.
So they have less headaches, they have less sinus problems, they have less ear infections, and so it's all just a matter of normalization of the function of the head. And as I'm saying that, I'm starting to understand where the article is going. Is the eustachian tube is the tube between the ear and the mouth, and that could be that the drainage situation, since you don't have the downward pull of gravity, it may not.
So they physically do it. They help each other drain.
Yes, and there may be a lack of circulation that's occurring because of that.
That's fascinating, isn't it?
It is.
But what's interesting too is that apparently there might be other reasons that could cause that pain that's caused by that buildup. Like, in other words, we have gravity, so there must be something else that's causing it to not move.
You mean in space or
here?
Or here. Yes, there. Like, for example, sinus cavity is basically a cavity. It's like a little cave, and there's a lining around it, and there's a little pinhole that drains it. So the lining that it's like a velvet lining on the cavity wall or on the cave, and that little pinhole is what drains that cavity. So if that lining swells or gets inflamed, or you have a sinusitis or inflammation of the tissues in the sinus, what happens? It plugs that hole up. that little pinhole, so the sinus no longer drains. So what does it do? The fluid still keeps dropping into the cave, but it can't drain out, so it starts filling up, and then that puts pressure, and we can pretty much know which sinus cavity, if it's below the eye, if it's below the cheek, if it's above the eye, so we know which cavity is is having the infection or the sinusitis or the inflammation.
And I don't know how many people are like me in this regard, but I can have pretty much anything wrong with me and still function. But a bad headache, man, I don't. I feel like I don't want to do anything. It is the one thing that can stop me in my tracks.
And a lot of people mention that, Larry. It's funny that you bring it up, but a lot of people do say that, give me back pain, give me neck pain, I can function. But once I have a headache, I can't function anymore.
I'm glad I'm not alone.
Yeah, so a lot of people say that. So what we do is in scenarios where they're coming in with a headache, if a patient walks in with a headache, we're trying to determine, is it a vascular headache like a migraine?
Right.
Is it a cluster headache? Is it a sinus headache? Is it a neck headache? Quite often it's that neck headache where the vertebrae is out of position at the base of the skull, affecting proper drainage, irritating the nerve that goes behind the eye, causing the pain behind the eyeball, and in fact sometimes affecting the circulation of the drainage of fluid in the head, which can cause it to back up also.
Do you think, this is kind of an outside question, but there's a reason for it, do you think that other cultures are more open to some of the techniques that you use in chiropractic than Americans have been? I think we're more open now than we were. But the reason I'm asking is because the Russian astronauts apparently have been doing this. Apparently we got the idea from them.
Well, possibly. I don't know the history of that, but I know that, for example, the Greeks used to do a lot of mobilization and manipulation, and they were very physical in wrestling and things of that sort. So it was used, and chiropractic, which the word chiropractic comes from the origins, chiro, hands, practice. So it's been around for thousands of years, and a lot of the rural villages, you don't have a physician, so the knowledge of mobilization is given from one elder to the next, and it's carried in those villages to allow people to be able to function. So it's been there for a long time. In the United States, it started, chiropractic started and was officially coined the late 1800s, and in the beginning, it was just like it is today, pretty much a word-of-mouth experience. And, for example, people who were going to see the chiropractor many years ago would say, my parents went to a chiropractor and they took me to the chiropractor, and that's how they experienced it. And now, because chiropractic is more mainstream, more accepted, has become scientific now at this point, that we can say, okay, this is why chiropractic works. People are much more open to it, and they use it as a first defense for neck pain, headaches, and back pain, sciatic pain, and that's good because it's safe, it's effective, and what we're doing is we're utilizing it as the first line of defense, and if that doesn't work, then we can step it up to more aggressive.
And it actually makes no sense to not do it as a first step. I mean, why would you do something invasive when there's a possibility you could be well with something chiropractic?
It's just a habit. Some people, they might get in an accident and they say, oh, I need to see the orthopedic. Well, the orthopedic is a surgeon, and they usually don't want to see you unless they can do surgery for you, and it's very rare those people need surgery. So it's just a matter of education that it's better to start at something that is more conservative, whether it's the rehab, whether it's the massage, whether it's chiropractic, whether it's acupuncture, things that are more safe, more conservative. You catch 90% of the problems and take care of them. The 5-10% that are not responding, then there's other treatment modalities that are a little more aggressive. So I think, to answer your question, Larry, it's just a habit that people say, oh, I need to see the orthopedic, but not realizing that orthopedic may not be the right specialty to go to.
Besides the jaw, are there other bones in the head movable? Do they move?
Oh, yes. Oh yes, they do. All the bones move. The sphenoid bone moves, the temporal bone moves, the frontal bone moves, the suboccipital bone moves. They do move. But as you grow older, the joints become more fixated, and there's less motion. actually when you breathe, there's some movement of the skull bones, because that's part of the circulation of the cerebrospinal fluid between your sacrum or the tailbone that moves in and out, and the movement of the skull bones.
Wow. And so is that part of the manipulation too, when you're talking about the head and the face? Are you literally pushing those bones a little bit?
Yes, with different techniques. Usually the pressure is a gentle pressure.
Yeah.
And, I could look at an individual and see their headache, because what happens sometimes is that you could look at their eye or their orbit on one side, and it's very small and tiny, larger on the other side. Maybe as a child they were laying on, they were always placed while the bones were soft on one side, so it flattens that side. Sometimes in mom's tummy, the baby is on their head and doesn't move very much, so they get a flat spot. We can actually mold and change those. Later in life, we can cause some shifting and movement of the bones of the face also.
Oh, you saw Robin hand me a note. I don't know if this is her question or if she took a phone call. But anyway, the question is, I keep hearing a cracking sound whenever I move my neck. Is that normal?
The cracking sound is not normal, and it means that there's some extra motion of the tendon, or it might mean extra motion of the vertebrae, or it could be some arthritis that's causing that possibly. But when you turn your head, you may hear a grinding sound, and if you hear like sand and grinding, that's basically arthritic changes of the joint or roughening surfaces of the joint. If you hear a clicking sound, it could be the tendon just flicking over the bone, or it could be that the bone is unstable. And this happens when we have somebody coming in that's been in a motor vehicle accident. A lot of force has been put on their neck forward and backward, and has caused the ligaments to get stretched. Now the vertebrae are unstable, so they move around a lot, and they can cause a little clicking motion because of that. And sometimes people who actually try to self-manipulate their neck and pop their own neck.
Like Dan does it.
He shouldn't be doing that.
Have you ever seen him do that?
Bring him over here. Let's talk to him about that. Tell
Robin,
him why he shouldn't be doing that.
Is this your question, or is this a phone call? Was it?
She's just smiling. She's not gonna.
Oh, it's somebody out there. It's you? It's somebody else. It's you. It's somebody out there. Okay.
She's not going to admit it.
Well,
if it's her.
I didn't hear the phone ring. Yeah. I usually hear the phone ring.
I just heard her fingers typing.
Well, just real quick, I know you do have a phone call now, but I remember after my accident saying to your brother, who was helping me,
yes,
I'm hearing something in my neck. I don't remember if that was there before or not. And he told me, no, that probably wasn't there.
Right.
And it did go away eventually, but
we'll talk a little bit about that after this call.
All right. Good morning. Thank you for calling. You're on there with Dr. Fakhoury.
Corey, this is June. How are you?
Hi, June. Good morning.
I'm happy to talk to you, and I have a question for you.
Yes, ma'am.
I might have asked you this before, and maybe I am losing my mind. But, I am doing my shoulder therapy there with the electromagnetic.
Oh, yes.
And that's helping me. And I'm wondering, because I can't turn my side either way because my shoulder hurts so much, can I get a back adjustment without having to go through that side turning? And I will hang up and listen. And thank you so much. You guys are a blessing to everyone.
Thank you.
Thank you so much, June. That's a great question. And yes, there are many, many ways to be able to do an adjustment on the spine, and we have a variety of different techniques to be able to work around the patient. And the key here, Larry and June, is working around the patient's need. We have some patients that are amputees. We have some patients that have recent surgery. We have patients that for some reason or other can't lay on their side. Maybe they have a bursitis of the hip and it's so painful they can't lay on their side, or as June is saying, their shoulder hurts so much they can't lay on their side for a low back adjustment. So what are the options that we have? We have the ability to use an activator and be able to treat utilizing that, or we can put the patient face down and use a Thompson table and be able to do that. So there's a variety of techniques that we can use just as effectively on the patient but not cause any distress or discomfort to the patient.
And it sounds like communication would be the key. Like if you don't know that it's uncomfortable, you won't know to tell her to do the alternative.
Correct.
Right?
Correct.
All right, you have another phone call. Good morning. You're on the air with Dr. Fakhoury.
Good morning, Dr. Fakhoury.
Good morning.
Last week we spoke about, trying to keep from getting humpback or, slumped over all the time.
Yes.
And I've been consciously trying to improve my posture.
Good.
And the more I do that, and it seems to be, I can still stand up straight, straighten my back out. But I notice that no matter what I'm doing, I'm always either looking down, I'm bending forward, or whatever, and that makes it kind of hard.
Right.
Just wondering if you had any suggestions there.
I do, and I think the best thing is find out what is the cause. What is causing this forward flexion of your mid-back, which we call a kyphosis? You told me last week that you can straighten up, which is very good, that you can come to a straight posture position, but then you have the tendency of falling back forward again.
Yes.
So the thing that I would do is after the evaluation, take a lateral x-ray or side view x-ray of the mid-back, and the thing that I would be looking for is any wedging or compression of the vertebrae of the mid-back, where instead of being rectangular, the front of the bone has collapsed or dropped down, causing a wedge shape or rhomboid shape that may cause you to fall forward because of that of the positioning of the bone. In a scenario like that, then there's some different options. Let's say that somebody does have a compression fracture, and if it's fairly recent, we can refer out for kyphoplasty, where they'll put that cement product to almost reshape the bone back into a square. Or the second option is really develop some stretching and some mid-back exercises where we can work the muscle groups of the back. Since we talked about muscle groups this morning, we can work the rhomboid and the trapezius musculatures and the levator scap musculatures and the latissimus dorsi musculatures to help pull you back and stretch the front muscles, stretch the pec muscles, so that way you can be relaxed in the front and stronger in the back, so that way it'll counterlever you back and help improve your posture. This way you're not thinking about it all the time. Your muscles will actually do the work for you instead of you constantly trying to remember to hold your back straight. So it would, at this point, since you tried your best and you still feel like you're falling forward, then it's probably a good time to get that evaluated, see what the cause of that kyphosis, and then address it according to the best course of treatment.
If I'm walking or anything like that, I have no problem keeping my back straight or my head up. It's just that it seems that everything I do involves either even keeping my back straight. I have to put my chin on my chest, practically to look down, and that's compounded by the fact that I have to wear these glasses, trifocal type things.
Yes.
Makes it kind of hard. So you're moving your head more to help focus in on what the heck you're looking at. Besides, everything seems to be down.
That's the case, isn't it? Many years ago, we would be working in gardens, we would be doing a lot of lifting, so we're pulling and using our back musculatures, keeping them strong, which keeps good posture. But unfortunately today, we're writing a lot, we're driving a lot, we're using computers quite a bit, we're using cell phones, we're texting. Everything is forward now. We have very little backward motion to keep our back strong, so our front overpowers our back, and then we have the tendency of being pulled forward and having the rolled shoulders where we hunch forward. So a good exercise to do, and for the listeners also, is that with your back straight, your chin up, put your arms up towards the ceiling so you have a U shape, and those that are watching on video, they can see. So have your arms up like you have a U with your arms, and then just squeeze with your shoulder blades, and don't move your shoulders, but just squeeze the shoulder blades back to try to work the muscles that are called the rhomboids, and those muscles will help over time to retract the shoulder. And do 30 of those squeezes every day. That'll be a help. But if you continue to roll forward, then let's evaluate that and find out what the cause. It's always good to get to the cause of the problem. If you notice something's not right, not working correctly, or you're having a problem, it's best to get to the cause of it so we know how to address it.
Well, I did follow your advice with the arms outstretched and going into a doorway.
Good.
And flexing that way.
Yes.
But, it just seems that I have no pain or anything like that when I do that. And it does feel good, and I also notice I feel like I can breathe easier, when you're standing up straight. Seems like you're lifting your your rib cage, to me anyway.
And you are, because when you roll forward and slump forward, you restrict your vital capacity or your ability to be able to expand your chest and your rib cage, so you breathe more shallow, and that's of course not a healthy state. You get less oxygenation, you're more prone to having upper respiratory infections. So the better posture helps you to breathe better, have more energy, and of course less stress on your neck and shoulders.
All right, well, everything you say makes sense, and I've been trying, practicing what you preached since last week, but I think I'll be making that appointment in the near future.
What?
Just seems like no matter what you do, you're bending your head forward to look down, and or whatever, all day long. So I seem to, regress into that, although I can stand straight, and I am standing straight when I'm not occupied doing stuff. But anyway, thank you very much, Doctor. You're very informative, and thank you for your program, taking the time out of your day to inform us all, and thank you, WOCA.
It's a pleasure. Thank you very much. Keep up the great work, and if it persists, that's a good thing to get it checked and look, as we said, to the cause of the problem.
I would say sometimes learning things, it's not always easy. It's better to go to the teacher or to the doctor in this case and get a little help. Sometimes, we try to do everything ourselves. It's not always a good idea.
Right.
Like we're fixing our cars. I mean, you can listen to advice all day long. It doesn't mean you know how to fix it.
And sometimes it's interesting. Sometimes the vertebrae in your spine, especially the one in the mid back, it can go right or left, or it can go back. So when a vertebrae goes backwards, it almost makes you feel like you can't straighten up. And that's one of the adjustments that we do, where we align the vertebrae and put it forward back into position, which almost makes the person feel like, when I finish adjusting, like I adjusted one gentleman, he's a CrossFit trainer and he owns a CrossFit store, or health center. But when I adjusted him yesterday, he said, "Boy, I feel like I'm 6'4" now."
Oh wow!
Because he could stand straighter, the vertebrae were lined up, and the resistance was just not there any longer.
By the way, that was Sonny on the call, and he walked past the window this morning, and he didn't look hunched over to me. Is it possible he feels more hunched over than he actually is?
It could be, and that's why sometimes getting an outside perspective that knows what to look for may help him with that, and let him know if he's having a problem, because some people may feel like they're having a problem and there really isn't a problem.
Yeah, well, we learned so much. I think I forget like 90% of what you teach, and then I have to ask it again in a week or two.
I'm glad you bring your questions in too. They're always great.
90% it's probably 99% of what I
think
forget.
So.
Always a good show, Doctor. Thank you for all you do for all of us.
Thank you, Larry. It's a pleasure, and enjoy being here.
We should have the healthiest town in the country, really.
I believe so.
Because you're here.
We've got great providers, and we have great healthcare systems in Ocala, Marion County. We're very blessed with that, to be able to have the best services close by. And
you are among them. Thank you so much for what you do.
Thank you very much.
We will take a little break and be right back. If you need Dr. Fakhoury's number, let me give it to you real quickly. It is 352-351-3413. Call me here at the station if you need that repeated. We have to run. Thank you, Doctor.
Thank you very much.
Accident, injured, hurting, pain affects so many of us and keeps us from enjoying our daily routine. This is Dr. Riadh Fakhoury, board-certified chiropractic orthopedist at the Fakhoury Medical and Chiropractic Center. Let me visit with you to answer your questions. Let us help you help yourself on the Head to Toe Care Show every Wednesday, 11 a.m. on WOCA. Again, that's Dr. Riadh Fakhoury, here to help you on the Head to Toe Care Show every Wednesday, 11 a.m. on WOCA, The Source.
Ocala's information station, 1370 WOCA.